Correcting children with single vision glasses should no longer be the first line of treatment. And today, with my colleague Paul Chamberlain, also an optometrist, we'll be tag teaming throughout this presentation to share with you some of the latest information that's been generated from the MySight One Day 7-year clinical study, the longest running soft contact lens study for myopia control.
What we're trying to do is address the core pathology of myopia, which is not just the continuing and inconvenient refractive error, but also the axial elongation which can cause future pathology.
We have children that have been recruited across 3 continents, including a centre here in Singapore.
The MySight lens seems to have slowed growth, not 100%, but it is at levels similar seen in what we might class as perfect emmetropic eyes.
When you're trying to get a parent and child into a treatment option, having this information can perhaps help get those children into that treatment program.
For these studies, because it's so long, then we know that the effectiveness that is able to control about 52%. So I'm more confident in prescribing it.
There's not many with data beyond 2 or 3 years, so it's comforting to know that we're still accruing a myopia control effect through 6 years. We treated 90% of eyes.
It's highly likely that your child is going to get some benefit from wearing MySight One Day.
And the faster progressing eyes, the ones that's heading towards high myopia, seem to benefit the most.
And the slower growing eyes came to a halt completely.
These devices have evidence of slowed eye growth through their youth period, and there's no evidence of a rebound effect.
The most interesting about the study is that even though patients who are not been using the myopia control and started wearing them still have a significant amount of myopia control effect on those that have been already been using lenses for a few years.
The benefits of modest myopia control far outweigh the risks. So taking millimeters off the table, taking diopters off the table becomes something that's really tangible.
We further use this data to actually help convince the parents to actually try MySight as well.
So we know loads about myopia, but there's still more to discover.
We remain committed to doing good research and sharing it publicly to help move this space forward.
Now we know that with soft lenses, with these additional benefits of able to slow down our progression, I'm excited to prescribe it and to gain more clinical experience on it.
So we know that if we can treat children as young as they become myopic and for a long period of time, the data that we have to support that information comes out through this clinical trial. So treat young and treat for as long as they're progressing to get the maximum benefit.